I started running when I was in middle school and in high school. I did mostly like long distance running. I started running marathons when I was about 19 and did a handful of half marathons too. So it's just what I absolutely loved and enjoyed.
Over time, those logged miles started becoming more and more painful for Jacqueline Nordin, specifically in her right knee.
My kneecap was tilted a little bit, so I had patella arthritis from the kneecap not being straight. So it kind of tilted to the side and it wore away at some of my cartilage. And that was what was causing all the pain and the arthritis.
For the better part of 2 decades, Jacqueline utilized steroid and gel injections to get by. But after the birth of her daughter, those efforts became less effective.
Definitely wasn't doing much for any of the pain that I was experiencing. And I was restricted on doing the things that I loved to do. My knee would feel painful, it would swell. First thing in the morning, I noticed like just that first stretch in the morning was like, took my breath away because the pain was so bad. So I just started reaching out to some of the best orthopedic surgeons, just looking for a better option than getting a knee replacement at 40 years old.
Not enough people know that there's other options out there. The traditional orthopedic model is you do injections until it stops working and then you replace the joint or do the surgery. But there's more we can do than just steroid and surgery. And so I want to make sure that people know there's other options for people to have respect for the cells that God has given us and being able to use those to get rid of your pain.
Jacqueline's search led her to Dr. John Buchanan and orthobiologic treatment to try and activate her body's immune response to help heal her knee.
The simplest way is by using your blood. If I use your blood, if your arthritis isn't too bad, the tendonitis is fairly mild, then I can use some of your blood and take the platelets out of the blood and inject that where it's needed. And then it wakes up stem cells that live in that area and then it can heal that area. So you can do PRP. You can do PRP with the fat. You can do PRP with the fat in the bone marrow.
I was pretty desperate and having a lot of pain. And so I knew that I wanted a less invasive procedure. And then when I found out that it was stem cells that were coming from my own body and injecting it into my knee, I was willing to give it a shot and see if it worked.
In her case, because she had so much arthritis, we needed to do more than just the PRP.
And I'm about 1 year out from getting my stem cell adipose bone marrow transplant, which they took the bone marrow from my hip and put it in my knee. I started feeling drastic results around 3 to 6 months. And being a year out, I have no restrictions and I feel amazing. So yeah, it's kind of emotional too.
The way I see it, orthobiologics is really the future of medicine. My goal is that the more cases like Jacqueline we get, the more cases that return, then it's going to be more mainstream and get more people, more help for more patients.
Dr. Buchanan, I always say the difference between a good doctor and a great doctor, the great doctors are the ones that are willing to, improve patients' lives with the newest and greatest technology. It's wonderful. So yeah, it did. It changed my life.